The second session for the day is Digital Health Services for Non-Communicable Diseases, Preventive Health Care. The moderator for the session is Dr. Ravi Gaur. He is the founder and chairman of Medical Advisory Committee, Unipath, DRG Specialty Laboratories.
Shall we welcome with a loud round of applause, guys?
The presenters for the sessions are Dr. Sanjay Sharma, co-founder FootSecure, Yostra Lab, Ms. Khushboo Agarwal, founder Zyla Health, Mr. Bhuvan Srinivasan, Chief Business Officer, Ultrahuman, Dr. Amit Raj, Managing Director, Plexus, Cardiac Care. The time for presentation is 7 minutes each. Over to you, sir. Thank you.
Good morning, everybody. I think after a very interesting session, first session in the morning, where we shared the journey and of course a wonderful message that the digital health is going to be here. That's something what we all are looking forward to. David, I was just listening to the session, and one of the questions which was asked was, what are the limitations and challenges in digital health? And the very fact is, yes, the doctors today, the medical fraternity, especially the senior one, they have some reluctance. It's not because they would appreciate the advantages of digital health, but the very mutual problem in mind is that it's a touch screen which helps. Actually, it's a physical touch which heals. And that's something the teaching what we have in our mind, because I'm a doctor by profession. Welcome to our this session, and it's my pleasure to chair and moderate this session on digital health services for, and of course, non-communicable diseases, preventive health care. I'd like to thank here again my mentor, VK Singh, because he has been like, I have served with him in the various higher altitudes of somewhere in Ladakh, way back 30 years when the Siachen war started. I think I learned a lot from him, how to build up a team, how to innovate, and that's I think I idea, because how to survive in an environment. We had very nothing, the war was on, but still we fought and we were actually fighting successfully. Thank you, VK Singh. This is, I think, I have my, my welcome to my co-panelists. We have Dr. Sanjay Sharma. He's a pediatric surgeon, and he's a co-founder of FootSecure and Yostra Lab. I think we'll be hearing him soon. Then we have Ms. Khushboo Agarwal. Welcome, Khushboo. She's the founder of Zyla Health. Mr. Bhuvan Srinivasan, and the Chief Business Officer, Ultrahuman. And Dr. Amit Raj is a cardiologist and, of course, the Managing Director of Plexus Cardiac Care. Welcome to all of you. And I think before a session will be, probably, because all of them are entrepreneurs, they have set up their own, startups, which was actually with a lot of wisdom and a lot of applications already applied in the field now. Probably they'll be sharing their journey. But before that, I'd like to just say a few things. Because, disease prevention is a central aspect of a primary care practice. That's something, today we are talking about illness. But the COVID taught us that there's something called as wellness, how to keep well so that you're keeping away from the illness. And that's exactly what we are talking about, preventive health. So it consists of primary, secondary, tertiary, quaternary level, all kind of various levels of the primary, the health, digital healthcare is actually now affecting that. Because problem is, despite rapid transformation, despite rapid application of digital health in the primary care practices, digital health solutions in preventive healthcare have yet to be put into practice. They're not fully come into the practice, and that's something what we are thinking about, how to make sure how people adapt them in rapid practice. Our regulators, the industry, or probably the scientists, even the doctors, they all appreciate the value of digital health when it comes to application. And the users are now actually getting benefited by that, but still there's a lot of limitations, a lot of challenges. This is something which is like, it's happening today, but this is the era of disruptive innovation. A lot of newer things are going to come, and I'm sure future is going to be there. And if not today, probably, not somebody mentioned about 10 years. I probably say, what Harsh was mentioning yesterday, probably 3 years or 5 years maximum. We are there, we are going to be. We already are there, and we are going to be there. Then the new technologies has come up, especially in the area of, neurotechnology. When you're talking about the digital healthcare application for, say, dementia, loss of memory, early onset of Alzheimer's, the early onset of Parkinson's, all prediction are really now. Actually, the technologies have been developed, and they are in the process of validation. We have cardiovascular disorders, because there is, I think we have an expert right here with us, probably be sharing his journey. But in cardiovascular also we have seen that when is first that is fine, when is going the second cardiovascular. I think this is the most important part. Again, various data, various analytics, AI, everything is being now, new predictions are happening, and new companies have come up in that space. We have something like healing, ulcer healing, correct, and the faster healing, because everybody gets some injury here and there. How does it, somebody heals fast, somebody heals later? I think all, again, there is a process behind it. Probably we'll have here somebody in the FootSecure right here with us. Diabetic monitoring solution, of course. India is probably going to be, or not sooner or later, diabetic capital of the world. So we need to, how do we monitor the various aspects of it? Can it be prevented? I think the best aspect of diabetes is, first, if you can diagnose, predict, somebody will develop 5 years from now, 8 years from now, you can delay the onset. If you delay the onset, you've done your bit. But if somebody has a chronic disease, how to avoid complications, how to monitor and make it, because in diabetics, especially in the silent MIs are very well known. If you can predict that silent MI, I think you can save multiple lives. Then we have, of course, personalized and comprehensive wellness solution. I was talking to other day to Sachin, right today, all of us, many of us probably must have got a preventive health checkup done. Now, when we go to a preventive health checkup, what do we get? We get a report. Cholesterol, sugar, thyroid, all normal. If you look at the 15 people, all of them may be having a normal report. But then, 2 of them land up with hypertension, 1 lands up with the cardiovascular tract, and somebody lands up with some diabetic issues after 6 months. Why? There are multiple other factors attached to this patient value. And this is where I think we have a personalized wellness solution. Your genomics, your environment, what you eat, what you drink, how much you sleep, how much you travel, and which part of the world you come from. Because genomics are diverse, because environment is different. Probably all this putting into a solution and developing AI, and then we go to put something called as personalized at-risk score, as health risk assessment. This already happening here and here and here. I think it has to be integrated together, and the future is right there. I've also seen something called a voice biomarker, where people speak. They say, okay, speak for 5 minutes, this kind of thing. And once you speak, you develop, they come out with some kind of algorithm. This is going to be differentiated. I think much more is happening into the digital healthcare, preventive healthcare, early healthcare, and of course, chronic disease prevention, which is that 40% of the population have some kind of chronic non-communicable disorder, whether it's diabetes, obesity, cardiovascular disorder, and it could be cancer, and I think these are the most common kind of disease. With this, I think without taking much of the time, I'd like to invite my first speaker, Dr. Sanjay Sharma. Sanjay, he's a pediatric surgeon. He has a wealth of knowledge. He's come from, I know I'm just going through his resume, probably list out of one full page. This is like he's been I am Bangalore, then he has the University of California, Berkeley, Ames, and fellowship from Glasgow, a lot many things. Sanjay, I think we'd like to have hear from you and see what exactly you do. Thank you. And I request all the panelists probably keep your presentation about 7 to 8 minutes, because after that we might have a more interactive session. Sanjay, please.
Yeah, thank you, sir. Thank you very much. So good morning once again. Good morning. Good morning. So can we go to the next slide? Next slide. So why wound care? We have been talking about cardiac, we have been talking about diabetes, we have been talking about So we've been talking about wound care, diabetes, cardiology and everything, and most of them ignore the first basic thing what we doctors learn, that's the wound. If there is any fall, there is an injury. If there is any, even as small as cut, surgical cut, it's a wound, and that's what we forget about. But there are something called as chronic wounds. It's not, it doesn't heal. That's why it's called chronic. And 2% of the population have chronic wounds globally. And chronic ulcers occurs in many adults. It could be diabetes, it could be venous ulcers, many things. So I don't want to get into the details of it for the lack of time. And these ulcers last almost about 12 to 13 months. An average diabetic foot ulcer in India takes about 12 weeks to 52 weeks for it to heal. You can imagine a person getting dressed over his wound week on week, day on day for the whole year, or even at times more than a year. Venous ulcers take almost 2 to 3 years, and I have seen patients 15 years of ulcer being there in the feet, and he keeps on dressing day in and day out. And why is this happening? The clinicians today, we have a cardiologist, we had a transfusion specialist, but we don't hear a wound care specialist today. We don't have a wound care specialist in India. We don't have a pediatric surgeons in India, very rare. We don't have a course in podiatry in India. So clinicians lack, it's not just India, clinicians lack the knowledge of how to treat a wound at this point of time. And that's the challenge that we are taking. That's the challenge FootSecure took to bring in AI and various 4D bioprinting and other things to bring to the table. So let's look at some statistics. Sorry, this time has to be deducted from my talk. Okay, so let me skip that slide. In the sense, let me talk over that slide by the time that they're coming up with. So let's talk about a diabetic foot, which is a major complication. Many people do not even know that a diabetic foot condition exists. A diabetes patient, if you say that the diabetes also affects your feet, they get surprised by it. Oh, is it so? So we have about 70 million diabetics in India. As you were saying that it's going to be the next diabetic capital of the world, possibly if we could prevent it. 34 million of them suffer from something called the diabetic peripheral neuropathy. 6 million of them have a diabetic foot ulcer, and 1.3 million amputations happen yearly. So I have spent about 2 minutes now, and we would have already lost about 6 legs somewhere in the globe. statistics say that every 20 seconds a limb is amputated due to diabetes. And the mortality rate is higher than cancer, and we haven't even thought about it. We have been talking about AI in cancer and digitization in cancer and cardiac and other things. But do we see the statistics here that it is just higher, the loss of life or the mortality because of the limb loss due to diabetes is higher than cancer mortality, cumulative cancer mortality. Only lung cancer has a higher mortality than a diabetic foot amputation. And we spend in India, average person spends about 1.37 lakhs to treat one ulcer. So that comes to about 10.5 billion US dollars or something like that. So that's the challenge that we are facing. And sorry for these ghastly images that you're going to see for this morning. I know there are other speakers which should make sure that you can have your lunch properly. But these are the images that we get every day in my phone. This is my phone WhatsApp screenshots, and they are asking, what should I do for this wound? How do I treat it? Because it's a long term. People travel from different villages, towns, get treated, and go back home, and they keep sending those images and saying, what is the next step? What is the next step? That has to be done. So I'm just stating these problems in terms of why AI is required for wound care globally. So this is wound feature that we need to extract in an AI solution. We have various components of how we can extract an AI solution here. And the AI, I'm not getting into the AI part of it. I'm not an engineer like you guys, or where you're learning it. This is more explained better by the AI specialist like Sachin, who is sitting here, or anyone else. But what we need to identify is the tissue. We need to have a wound measurement. We need to have the color and texture of the wound, not just the wound, but the peri-wound area and other things. We have to have a wound bed recognition, and we have to have a wound edge recognition. So this is what is required for us to predict how fast the wound would heal and what kind of dressings, what should be done for the wound. And manually, when we start doing this, there are about 44% errors in this area, 36% error in volume measurements using AI modules till date. This is all published papers that we have. And about 84% errors in characterization of the wound using the AI models. 84%. They are unable to characterize the wound as on whatever the applications that are available today in your app store or the Play Store. No work or invention has utilized all modalities like images, shapes, text. Most of them focus on images. They do not look at texture or the shape of the wound. And measuring volume using the AI is still a challenge. I'm saying that there could be 3D models and other things, but I think today's cameras are there where there are more than 2 or 3 cameras in the phone, and using those 2 or 3 cameras, we can measure volume, but that's still a challenge today, and prediction of healability is still a pipe dream. So, 44% in area, I think we discussed this. So what we have come up is a Wound 360 is an app that is already available in the Play Store and the App Store, where some of these challenges we are trying to solve. So this is the tele-wound care application where it's a chat-based model where it kind of asks a couple of questions, asks you to take the image of the wound, and then should be able to predict what is happening, what needs to be done. So as you take the image of the feet, we will get the area of the feet. The wound bed is kind of separated out, wound edges are separated out, and it will say whether the wound bed is necrotic, whether the wound bed is granulating, whether the wound bed is sloughy, how is the wound edge, what is the shape of the wound edge, is it undermining, is it sloping? So that's something that can be recognized using an AI. So some more images that we see, how is the wound. So here you can see a blackish image of the wound bed, and that is how it is being recognized. Various other images of how the area is being recognized, how it is comparable, week on week, based on the color of the wound bed and the edges and other things, how it is being done. You can also see the graphs that is being there. But this is one on the imaging part of it. We'll do an AI, and then we said the next step. It could be telling it physicians what needs to be done using the AI or what needs to be dressing. But we said, let's go one step further and how AI can be used in actually treating the wound. And we came up with something called the 4D bioprinting of the bio ink itself. So we are taking why is it called 4D? Because it takes time also into consideration and not just the 3D dimensions. So this is the Darren platform, which is an innovative AI-enabled 4D bioprinting module that was where it takes the fat from the abdomen, nanocrystallize it, and then 3D print the fat and then placed on the healing healthy granulation tissue, and which gives a scarless healing going further. So this is the process of how we do a debridement and AI-assisted software. The app that I showed you, that we are going to use that app to recognize the wound, size it, and then also it calculates the volume of the fat that is required for that wound. We do a liposuction and then nanocrystallize it, 3D print it, and apply it onto the wound, which would we will see at 8 by 8 size, 8 centimeter by 8 centimeter size wounds will be healed in about 4 to 5 weeks, where in comparison to 12 to 58 weeks, that is an average there. A few of the examples of what we did on using the 3D platform. Okay, let me skip the video. This is how the healing. So that was the video of the actual how we are doing the whole process of AI app be capturing the wound areas and then actually bioprinting it and placing it on the ulcer area itself. This is some few of the cases where we have done the AI assessment and then did the 4D bioprinting. You can see week 3, week 5 how it has been healing. So you can see the completely healed wound that we say in week 5. Again, a completely healed wound that we see here from week 0 to week 8. Yeah, so at the end of it, what I would want to say is, as it's been echoed by the previous sessions, also the future of healthcare is not about technology, but about how to make technology invisible so that it fits inside a seamless workflow that is empathetic to the patient, where providers can put the technology aside and give time to providing the care. So technology should not be a barrier for us as clinicians. When you create technologies, it should be a part of us, as the madam said earlier, that it is not artificial intelligence, but it's augmented intelligence. Thank you very much.
Thank you, Sanjay. I think we have a couple of questions for you, probably once we are all done with. Rightly said, this is an AI. When we talk about AI, of course, we all talk about nutritional school or IT centers, but I think it's more for medical professions, more of augmented intelligence. It helps improve our productivity. And then one thing I probably expect as we move from FootSecure is, they say, like, it's basically, to heal a wound, we should not touch it. That's what it probably said. But I'm pretty sure, because this is where we're talking about getting up various images, picking up various factors, applying the technology, and getting up maybe the newer processes so that we put that into a routine practice. And something very new thing we're talking about, and I think the future is pretty bright, and we look forward to hear from you as we move forward. Thank you, Sanjay. My next speaker is Khushboo. Khushboo is the founder of Zyla Health. I don't know much about her, but I think what I have understood, what I have read, what I have been really more into much of you can say emerging technology. She worked very well in that field. She with the care management platform, and that's a personalized diagnostic solution, personalized, I think, healthcare solution for that matter. Zyla, we'll hear from you, please.
Hi, thank you so much, Dr. Gaur. It's indeed a pleasure to be present here. I'm Khushboo Agarwal. I'm the founder at Zyla Health. We were founded in 2017, and as Dr. Gaur was mentioning, we are into personalized care management for people across the country in various ways, and I'll talk you through my journey. Before I start, I would like to begin with a very simple question for all of you, and that will be: how many of you have a close family member who is living with a chronic condition? It could be a diabetes, a cholesterol problem, thyroid, liver problem, fatty liver. Show of hands. How many of you have a close family member who's living with a chronic condition? So I would say more than 80% of you raise your hands. It is an epidemic as we speak. I will now ask a slightly personal question. How many of you have lost a first or second degree family member or a close friend to a chronic condition? Almost half of us, right? So it's a problem that all of us are living with, and we barely talk about, right? It's not something that is discussed in lecture halls usually. It's not something that is of common interest to a lot of people. Most of us, as we start hitting the age of late 20s, early 30s, start seeing these problems in our immediate family, with our parents, with our uncles and aunts, and suddenly it hits us. We suddenly get existential crisis. People who were out in different countries, people who were busy to have lunch and dinners with their parents, are suddenly found in existential crisis. What just happened, right? And why is this happening? What happened to my utopian world? This is a way, a similar story happened with me, and just to share that anecdote with you, I'm very passionate about healthcare. I've been doing healthcare for 12 plus years now. I went to BITS Pilani, did my pharmacy honors. At some point, I thought that I wanted to sort of change the way drugs work in the body and how drugs evolve in the ecosystem. I went to do my MBA from InnovatioCuris, and then I was, doing a consulting job with Deloitte for 7 years, mainly based out of the US. And there I was working on something called value-based care, right? So value-based care is a very important concept for those of you who do not know. It means how do we enable providers, which is doctors or hospitals, right? Many of us see here very able doctors already. How do we enable the provider system to be paid for outcome and not just for volume of care? So you went to a doctor or you went to a hospital, instead of the number of hours spent or the type of treatment you got, you also, are reimbursing the hospital or the doctor basis the outcome that was shown, the eventual clinical outcome or the improvement in health. So this is a concept of value-based care we were practicing in the US. I worked with large insurance companies and enabled that in that market. Mind you, in the US, the market is completely insured, right? 98% plus people will have insurance, and not just your hospitalization, but even your doctor visit or a pharmacy purchase will be sponsored by insurance. So that was the work there, and we enabled all of this. And in 2015, while I was in California, something happened back home, right? I got a call from my mom late night, and she said, Khushboo, come back, your dad just had a heart attack. And my world fell apart, right? I had the biggest existential crisis that ever could, because I was this healthcare professional who was doing fancy healthcare consulting for fancy healthcare companies, making fancies of billions of dollars, and my own father just had a sudden heart attack. So he's been a diabetic, etc. But we thought, your dad's always your hero. You thought things are fine. He's a little unwell sometimes, but his diabetes out of control, but things will be fine. And suddenly this happened. So I flew back in, and next 1 year I was living with my dad in and out of hospitals. Went to Yostra, and I think I heard Miss Upasana was here. They saved his life with the first PTCA they did. And then, he had an open heart surgery at Medanta, and they saved him second time. Thankfully, he's doing fine right now. But the message I want to share here is that this could have been prevented, right? We knew he has diabetes. We knew there are symptoms that hint towards the symptoms of cardiac issues. And Dr. Amit, I'm sure, will talk about it much more later. But we couldn't save that heart attack. His heart pumping went down from a normal 55% to a 25%. His heart was hardly pumping. And then we did a number of things to save him, but that's when I decided that I'll dedicate my entire life to save the next heart attack, and that's what I do for a living now. So, just to move on. Thank you so much. These are some quick facts I want to talk about, right? If you are an Indian, there's 25% chance you will die of a chronic condition. 5.8 million Indians are dying of a chronic condition every year. Now guess the number of people in India living with a chronic condition. We saw an 80% rate here of people having a chronic patient in their family. There are 250 million Indians living with a chronic condition. That's 1/5 of our population is living with a chronic condition. If you get a chronic condition, 60% or more of the expenses you pay out of pocket, right? A chronic patient on an average is spending up to 20,000 rupees a year just on medicines, lab tests, and doctor bills. And mind you, over 80% Indians do not even have adequate insurance to sponsor their hospitalization. Forget your OPD, doctor visits, pharmacy labs. 80% do not have adequate insurance that if tomorrow they get hospitalized, someone will pay for their hospitalization. And above all of this, even though we have outstanding medical talent, I would say, I have lived in those hospital corridors. I can vouch for the medical expertise living in this country. But even then, we do not trust the doctors, right? There's severe trust deficit. Oh, I am ending up in a cardiac unit and they're asking me to put a stent. Do I really need a stent? Or does my family really need a stent? Or is this doctor trying to make money, right? And this is sad. We have the best of medical talent and this trust deficit exists. So, if you see this slide, you will also notice that 50 million people in the country every year are pushed to poverty. They sell their houses, they sell their gold, they sell their FDs, they liquidate their FDs because someone in the family got cancer or a major heart event or a major chronic condition that led to a hospitalization. 50 million people, right? That's 5 crore people a year end up in poverty. If you have diabetes, and I think we heard Dr. Sanjay talk about this, and you end up with a complication, your hospitalization, your medicines, your bills, your doctor bills, pharmacies, everything together will increase your medical expense to 4x, right? Year on year, you'll be spending 4x or more. Now, what is going on, right? We are a country of 1.4 billion people, 140 crore people. We know that 25% or 20% people are living with a chronic condition. We know that majority of them will go to a complication. Why are we not doing anything about this? This is billions and trillions of money spent every year in managing those complications. The problem, my friends, is the ecosystem, is how the ecosystem is structured, right? A hospital or a doctor today is incentivized for the volume of care they provide, right? Unfortunately, in hospitals, we still have OPD to IPD targets because they have to run their bills. They have to sponsor the expensive CT scan machines, right? Also, the care that you seek, right, is hardly one visit of a doctor per year or not more. Correct me if I'm wrong. You may be going to a doctor, your family, your parents may be going to a doctor once in the year for 5 minutes, 10 minutes. So out of 365 days, right, into 24 hours, you sought care for 5 minutes. While care had to happen throughout because we don't know when the next symptom appears. So the problem is the ecosystem or the approach, I would say. Until the 2010s, we were dealing in India with a very physical infrastructure, right? We were setting up hospitals, doctors, labs across, and that infrastructure was rapidly increasing because our population has been rapidly increasing. Thereafter, we saw that infrastructure moved online, right? We saw the Practos and the 1mgs and the pharmacies come to life where we could get things online. But did the approach change? Did anyone say, hey, you're seeking this healthcare from me, I'll ensure that your health becomes better tomorrow? No one made that promise. So the change in the approach in the ecosystem has to lead towards a care delivery-led model, which means anytime you seek healthcare, someone has to make a promise that you're spending 10 rupees or 10,000 rupees or 1 lakh rupees, hey, I will get you better. That is the care delivery layer that we are trying to create at Zyla, which means that anytime you come on to Zyla, you discover Zyla through your insurer or through your corporate, someone who's paying for your insurance. You discover Zyla because it's your added benefit. We do a detailed assessment on your health, right? We do a personalized assessment to understand your family history, your diagnosis, your symptoms, your lab reports, any surgical history, your day-to-day lifestyle, your addictions. 300 plus parameters are analyzed in various ways, and thereafter we present to you a health assessment report. We do this for large populations. We do it for millions of policyholders for insurance companies, of thousands of employees of corporates, and then we tell them, hey, this is the risk pyramid. There are certain 15% people in this cohort, for example, who need urgent attention, otherwise they may get hospitalized in the next 3 years. And then we enable care journeys for them through our product. The product that we have created is very close to heart. We knew from day one that if I have to provide that continuous care I was telling you about, to ensure that if a diabetic is having certain gastric issues, which actually could mean a heart attack, I'm able to read that symptom, right? Or if someone is living with a triglyceride level of 450 and smoking daily, I can tell them, hey, please get your echo test done because you are at risk of a heart attack. What we did was exactly this. We created a 24/7 care engine, the Zyla app, in the hands of every user. Once I understand your data points and your longitudinal health record in detail, I enable your care on Zyla, which is a 24/7 conversational platform which talks to you, becomes your best friend. With empathy, will ask you every day on the latest symptom, latest lab result, or the impending test that had to happen but did not happen. It becomes your best friend, yet your family doctor. And through an in-house team of doctors, we then ensure that the human touch, the augmented healthcare we've been talking about that you need, is there. A doctor is talking to you frequently, a nutritionist is helping you with what to eat right from your kitchen, or a physiotherapist is designing the most optimized exercise plan. We ensure that through our algorithms, we can predict the risk of different complications and ensure that we do the testing or intervention in advance, so I prevent the next heart attack or the next kidney failure. So this is all about us. I am very eager to see many of the young brains here take up the path of entrepreneurship. It was not easy, overwhelming when I started out, and I think it, for me, needed that epiphany moment of sorts. But I would really tell you one thing. Beauty is in solving an unsolvable problem and not in just doing a regular job. So go for it, my friends. Thank you.
There's an announcement. Lunch will be served after this session around 11:55. Presenters, the time for presentation is around 7 to 8 minutes. Thank you.
Thank you, Khushboo. I think great to hear about Zyla. I think very personalized healthcare solution, what I was talking about. I think one thing I just comment before we have short of time, we have to go to the next meeting. It's a fact. If it, some couple of days back, somebody sent me a small creative in WhatsApp. A patient cured is business loss. I think probably that may be the industry part. Fact is, for the medical profession, I feel a patient cured is a business gain. Because one patient is cured, you get 10 more. I think that's something what we all see. It was I think as we move forward with various technology and various processes, probably we should have a health manager. And I think this technology we're talking about, because they have to be I think we'll talk about it right from it. Thank you so much, and I think I'm working on, I think right here, because you're a startup, you're like young innovators, probably maybe something we can meet offline and work on something what I'm already working on. Pleasure, thank you. I think the next speaker is Mr. Bhuvan. He's the Chief Business Officer at Ultrahuman. He's actually, worked in various private equity, healthcare providers, and he has a vast experience of KKR, Bain, and Watson, and where or not. I think what we're talking in Ultrahuman is probably today is the era of biomarkers, and diabetes is one thing. Biomarkers, how these biomarkers help actually monitoring and making the life of diabetes better. Something that I understood. More from
Yeah, thank you, Doctor. So I think I really enjoyed the previous session as well, and when Geetanjali was talking about her journey, it sort of reminded me of mine. I started off as a biomedical engineer. I was at Johns Hopkins. I wanted to be a doctor. Then I started my PhD. Then I dropped out of my PhD, which was going to be in computational biology. So this was 20 years ago. And we were the only lab in campus who had computers. And obviously, when our professor stepped away, we used those to play computer games and shoot each other. So after that, after I dropped out of my PhD, I was an R&D scientist in the US at Medtronic, working on continuous glucose monitors. So this was in 2005. This was 6 years after they were invented by Medtronic. got interested in business, so did consulting, and then went back and did my MBA at Wharton. This was the time when Obamacare was being discussed, so a lot of value-based care was being discussed, debated. Is it going to work? Is it not going to work? It was like a 1,000-page policy document that all of my classmates read and debated for a long time. And then the last 10 years was in private equity. So I was, doing investments like Blank Pharma, Max Hospitals, things like that. I probably walked pretty much every large hospital in India. And after 10 years of that, I said, look, I really want to get back to technology. I want to work in a small company, which is taking on big problems, and joined Ultrahuman last year. So while I'm a chief business officer, the reason I'm here is because I also design the clinical trials. I'm the one who speaks to all the doctors and so on, and will explain the structure of the team as we go through. So let's give you some background. So people talk about cardiac, people talk about neuro, people talk about oncology, and they should be talking about all of these things. What they don't talk about as much is metabolic health. So what is metabolic health, right? So I don't know how many people took biology in school, but inside your cell, inside every cell, you have mitochondria. And mitochondria are really like the power plants of your cell. They create energy. And the issue happens when over time, your mitochondria stop being able to use that energy or produce that energy. And then that affects lots of things downstream. But that's sort of the end point, right? So let's say you have diabetes. If you go backwards, you will have pre-diabetes. If you go backwards, you probably have lost control of insulin secretion in your body. If you go backwards, you've lost control of glucose in your body, the ability to regulate glucose. And then prior to that is some lifestyle issues that you have been having, right? And we'll talk about what lifestyle issues mean. But essentially, a lot of the metabolic health issues start with some issue with your lifestyle. It could be sleep, it could be food, it could be exercise, it could be stress, any of those things, right? So what we said was, look, metabolic health is really, really important because it leads to things like diabetes. They're also finding links with metabolic health and cancers. There are insulin sensitive tumors with cardiac issues. We talked about it already. One of the diabetologists I was talking to, he said, everybody knows that once you have diabetes in 10 years, on average, you will have a heart attack. And I said, doc, people don't know that. It's you know that because your patients go through that, but people don't know that. So there's this, metabolic health is really the foundation of a lot of other things. And the reason for that is it really affects every cell in your body. So that's the reason we sort of got focused on it. We don't say we're focused on diabetes or non-diabetes and all that. That's why we're trying to spread the word about what is metabolic health. I think your projector is becoming... Okay, got it. Power saving. So this I'm not going to talk about. I think the other speakers have done a really nice job about talking about it. I think what I just want you to, again, keep in mind is beyond diabetes, there is obesity, there is PCOS, there is fatty liver, there's a bunch of other stuff which all has the same underlying cause, right? And if you go backwards, it all has to do with some issue in lifestyle. So there was a fantastic study that was done almost 20 years ago, which showed that if you lose 5 to 10% of body weight, you will reduce your chances of getting diabetes by 60%. So, I mean, how amazing is that, right? Versus if you start diabetes medicine early, which was metformin at that time, you will reduce your chances by 30%. So lifestyle change is twice as powerful as medication if done at the right time. So I think that's what all of this is all about, right? When we see these charts, we say, oh man, it's inevitable. Like India is just going to have more and more diabetics. Obesity is just going to increase over time. I mean, there's no stopping this thing. But actually, you can stop this thing if you take the right steps. Again, we started with this quote. So I think some of the other speakers have addressed this as well. Usually, curative care is what we associate healthcare with. You get sick, you get ill, something hurts, you go and find somebody to help you. That's what 99% of the healthcare system really represents today. But the preventive health side, it's much cheaper to do it. You will have a longer life, you will have a better life. There's this concept of health span that is coming up, meaning you might live to be 90, but out of those 90, how many years can you pick up your child or your grandchild, right? How many years can you sit on the floor? How many years can you actually walk by yourself? So there's this new concept of health span, which is how much of your life can you actually sustain the things that you want to do. So there are lots of interesting things happening, and this is sort of a new topic of longevity that's also coming up. And what the way some of the doctors in this space think is, look, what do you want to do when you're 80? So when you have a consult with them, they'll say, okay, at 80 years old, do you want to run a marathon? Do you want to run a half marathon? Do you want to run an Ironman? What is it? Do you want to pick up your grandchild or your great-grandchild? And then you work backwards. So you say, okay, I have to be at a certain place health-wise when I'm 80. So go backwards. I know I will lose 10% every decade. That's roughly what happens with sarcopenia and stuff like that. So go backwards. So now I'm 40. What should my state be such that it keeps declining, and by the time I'm 80, I'm able to perform what I want to do? For 99% of us, we are nowhere in the state that we need to be. So, but that exercise is quite enlightening, because otherwise, what you imagine your 80s to be, and you're not going to get there unless you put in a lot more effort today. And if you put in that effort today, you will actually use less of the healthcare system, the curative side of the healthcare system. So that has huge implications on obviously your well-being, but also implications on the cost. So India is not yet struggling with cost, like at a systemic level. We have very, very good and affordable healthcare. But as the country gets older, as the country gets richer, you have seen what has happened with places like the US, right? So if you guys are not aware, the healthcare spend in the US is larger than the GDP of India. And the healthcare system in India, the spend on that, is the equivalent of the healthcare missed payments. So 5% of the payments in India, in the US, get screwed up, right? There's a payment issue. That's the size of the healthcare spend in India. So right now we're very small, but that's going to increase dramatically as you get older and if you don't do anything about it. Okay. So what do we do differently, right? What does Ultrahuman do differently? We draw inspiration from consumer and tech companies, right? What are the issues with preventive health? People say, oh man, it's so difficult to change habits. But they're on Instagram and YouTube all the time. How are these companies managing to create these habit loops which are so strong and so sticky? You're not sleeping, you're not spending time with your children, you're probably watching this while you're driving, please don't do that. But people are doing this and it's super sticky. How do we draw inspiration from that? We don't have access to relevant communities. I'm sitting in the middle of India somewhere. I don't know, how do I lose weight? I don't have a gym, I don't have maybe the right type of doctor, I don't have the right type of nutritionist. How do I do that? I mean, this has been solved. Like, people have various esoteric interests, they connect with people across the world. Why should I pay? Biggest question in preventive health. Why should I pay today? Nothing's hurting. Why do people go and buy like Apple computers, iPhones, Tesla cars? It's because there is an intrinsic motivation there to want something else, right? So you can call it Maslow's pyramid, we can call it FOMO, we can call it, I call it techno lust in some way. But that it's already exists. You can see examples of this existing. Can we use that? In some way I say use that for good rather than for evil, right? Like, I'm not saying these companies are evil, but these companies, the main thing that they're trying to do is have you spend more. But what if you spend more but also end up fixing your health at the same time? And the last one is, why should I do anything today, right? There's this concept of discounted cash flows in finance. 100 rupees 20 years from now is worth a lot less than 100 rupees today. So the same thing, man, if I'm much better when I'm 75 years old, I'll deal with that at that point. Why do I need to change anything today, right? So versus you look at companies like Nike, Red Bull, I'll just go back and forth so you can see that these are companies that are so good. Like, Nike sells shoes, but it makes you feel good when you're running, right? Red Bull sells the worst stuff for you, which is a bunch of chemicals and sugar, but they make you feel like you're doing something adventurous. You think of Formula One, you think of skydiving, you think of like mountain biking when you're drinking it, right? Why can't we use some of those things when it comes to healthcare? So what I'm really talking about is sort of a Trojan horse approach. If you go to somebody and say, you have to go to a doctor today, even though you're not sick, that person will say, dude, I'm not motivated to do that. I have better things to do in my life. But the idea is make it interesting for that person to access healthcare before they actually need help. That's what we're trying to do. You'll see that in the team. So Mohit and Vatsal were the co-founders. I joined a bit later. They're experts at consumer, right? So they scaled up Zomato to 60 million deliveries a month. Experts at data, experts at consumer. I keep joking with them that you got really good at selling people 100 rupee biryanis so that you could build this market for us when they launch Ultrahuman. And I obviously have more of a healthcare background. So that's the consumer plus tech plus healthcare angle that we're bringing to this. We use wearables. So we have a ring that I'm wearing. We have a glucose monitor. We put that together to figure out your lifestyle, which is what is the other issue that we have is people say eat better, exercise more, sleep better, stress less. And I don't have time for all of that, right? Like, who has time to do work on all of those things all the time? That's just too exhausting to even think about. So what we're trying to do is figure out in your lifestyle, what is the one change you can start with? Is it eat half an hour earlier? Is it eat half an hour later? Is it walk a little bit after your lunch? Is it do some strength training? What is that thing? And then try to optimize that for you. So have it be as personalized as possible. And we do that through wearables. You cannot be in the digital health space without reaching people where they want to be. You have to be on social media, you have to be on podcasts, you have to be on blogs. Wherever people are spending time, we have created media to reach them because much of the preventive health game is really all about awareness and making it easier for people to understand why they need to access this kind of healthcare earlier. I'll switch. So we talked a lot about consumer and tech, but we're not letting the healthcare side go, obviously. We're definitely a healthcare company. So we also have scientific and medical advisors. So the idea is bring all of this expertise, which today exists mostly outside of India, but bring that expertise to India as well. So that's one of the key things that we're doing. The ring that we're making, for example, this is like a tiny thing. You guys should come up and see it during lunch. It's got so many sensors in it. Something like this has never been made in India before. So, and we're making it in Bangalore. We just started production 3 months ago. So the idea is to bring a lot of that expertise to India, and we have, like Khushboo was saying, there is so much expertise. I think we just have to bridge the gap to, a product or a service or a software. Historically, as you guys would know, Indian software engineers have been focused on serving abroad, whether it was IT BPO in the start or SaaS later. But I think a lot of that expertise exists, and we just need to tap into that. I will skip some of these things. We're doing a very large clinical trial, 100 people with CGMs, so we're getting thousands of data points over a 14-day period. Again, to go back to the point of healthcare is really good at tracking outcomes. Apple doesn't care whether you're going to click your mouse 50 times, 50 milliseconds faster. Apple doesn't really care about that. They don't care if your PowerPoint gets created faster. But in healthcare, you have to show that you're better. Why is your solution better? And that's what we're doing with the clinical trial as well. All of this would not be worth it unless somebody's benefiting, right? So what are people using the platform for? They're using it for weight loss. They're using it to reverse prediabetes. They're using it for athletic performance, like Ironman. This guy shaved 1.5 hours off his Ironman. And then more importantly, also just food optimization. There is too much confusion. My mom told me some food is good. The newspaper is telling me some food is good. The Horlicks ad is telling me some food is good. It's too confusing. So something like this, which tells you what is happening inside your body, is the best way to figure out what is good for you. And that's what we really think, personalized medicine, personalized lifestyle change is going towards. If you think about self-driving cars, if you think about AI, it's all built on this data layer, right? Like where the oil data is the new oil, as we talked about. So that's what we're really trying to figure out. How do we capture this data so that we can then provide better advice, better notifications for our users? Quickly, some results at a population level. So that was more qualitative. This is more quantitative. So what you see on the left-hand side is glucose variability comes down within 15 days. What that means is there's a concept called oxidative stress, which means the more variability that you have, the higher your chances of getting a heart attack or something later on. If you can reduce that variability quickly, over time you will have a lower chance of having a heart attack or a cardiac issue and damage to your blood vessels. So you see that very quickly. Again, the problem is the guy will say, man, my heart attack is 20 years out. I don't care about this stuff. I'll put it on in 10 years, right? So that's why the graph on the right is helpful, which is time and range. which means how much energy do you have? Has everybody felt this, post lunch, about 2 o'clock, 3 o'clock, you start feeling drowsy, and you sort of lose an hour or two of productivity during that time. You probably think, oh, that's when I need my coffee and stuff. That's actually happening because your glucose went up during lunch, and then it's falling. So when it goes up, everybody feels great. But when it's coming down, that's when you start feeling that. When you put on a glucose sensor, it tells you what you should and should not be eating, and you prevent that spike and that crash. And that's when you have very, very stable energy. So if folks have tried intermittent fasting, if folks have tried keto and gained mental clarity as a result, this is what you're benefiting from. In the end, what are we trying to do? Do you know what sensors are in your phone? Like, do you know what the cameras are made of? Like today, I feel healthcare is at that level. You're like, oh, what is my HbA1c? What is my blood pressure? Etc. What is my blood glucose? We talked about glucose so much. All that doesn't really matter. Like, what matters is how do I use that information to help you change behavior over time, right? Why is the iPhone good? It's because it takes better pictures. Do you know that it was only 12 megapixels till the last one? I mean, if you really looked into it, maybe you would know, but most people don't really care because it just took better pictures. So I think the idea is in 3 years, 4 years, 5 years time, you will just have things which are like a package, and it'll doesn't matter what you're measuring underlying, because the sensors will get cheaper and cheaper and cheaper. It'll matter whether you're able to actually change people's behavior and get better outcomes. So that's what we're focused on. Thank you.
Thank you, Bhuvan. I think we talk about something which we all know about, that's metabolism. But I think we don't hear much about it. Because I think what we really require in metabolism is, when we talk about metabolism, is, oh, how much calories should I eat? 5,000, 2,000, 3,000, all stuff. I think that's something what we do. But we also understand as we grow old, our metabolic system goes down. I think I just posted something from the author who said, probably if you look after metabolism, the right book he made, Longevity Simplified. I think that's something which is going to probably be the answer, to look after metabolism. It definitely, I think, reduces your stress, you sleep better, increases productivity, and probably one thing I didn't talk about wearables. I think a lot of people do wear wearables, but I think if you can make them more cosmetic, probably people will use more. For one, you talk about rings, something you mentioned.
So we just started production of our range. So come by and see it. But really, my next project. Thank you. So it's available in 4 colors, 7 sizes.
And maybe available in Tanishq, right?
Yeah, no, absolutely. So I think the next thing is, look, we wanted to be invisible, right? So somebody had mentioned about technology being invisible. I want people to forget about it. So
I can mention one product, something what you said, I think one of the GAD area, Rajasthan, one of the medicine institute there, especially for the child, the girl child vaccination. The vaccination link in the hospital, there was somebody who was donating them to rocket. It's a small chip, and the chip had all signals, and whatever the vaccination was due, the signal alert was going to work. I think that's something from innovation would talk about. Something what you mentioned, but we maybe don't have time, probably we'll have offline discussion on this. But most importantly, one, what I'm going to eat today. If you get a ring, tell me, I go to a hotel, please order this thali. That's going to work wonderfully well. Thank you so much. We'll get back to you. And we have now Dr. Amit Raj. Amit is a managing director of Plexus Cardiac Care. I know him from a pretty long time. And he is a very highly qualified cardiologist. He works very well in digital health, and he's been abroad. In fact, he's worked a lot on AI and the machine learning. So he's doing great work in Gujarat, and probably I could hear him much more what he's done in the last couple of years. He met Amit.
Yeah. Well, I just have a few minutes left. I just zip it fast. My fellow colleagues in the panel, they have discussed. Khushboo did mention about a family member, a father getting, some kind of a cardiac problem. I'm sure most of us all have gone through, and myself, I have gone through that as well. So that's where I have thought of exploring opportunities of innovations in healthcare delivery. I started my life as a physician, as a hospital entrepreneur, building hospitals, meeting investors, blah blah, and all this journey. End of the day, we found it's only on just P&L balance sheets and the turnovers. There's no value which we create. And suddenly, there's a turmoil in my family. I lost my brother in a village, in a hospital. Let's now get into specialty hospitals, especially in cardiology. Then I did my fellowship. I started learning cardiology, getting a super specialist degree in cardiac. Then I thought, I lost my brother. Many people can lose anybody. So that kida came into my mind. I said, let's put something in this. Why focus on only larger cities where same equipment, same doctor, same surgeon working in tier 2 city and a metro. So these are again a problem statement and a gap. So my vision was to set up small scale shop and shop heart hospitals in different small towns of India, especially the tier 2, tier 3 cities. So and then you must be watching my business school journey. Yes, as a hospital entrepreneur, I need to know the economics scale, the hospital functionalities on how do I build. So this business schools have given me that insight that yes, doc, you can create from zero money 100 million empire within no time. So that's again, that inspiration moved me to set up smaller hospitals. I'll just quickly go through what exactly I'm doing. I'm in a small city. I started my journey of a hospital, heart hospital, shop and shop in Gujarat, Rajkot. It's a small 28-bedded heart hospital, both cardiology, cardiovascular, cardiac ICU, surgery, OT, blah blah, in a small space of just 4,000 square feet of space. And then build the heart hospital, which I can say I have equipment better than what or equivalent or better than what corporates have. So my assets of a medical healthcare delivery, that's the cath lab and the OT are super class. And then again in a conference where I was presenting this kid of mine to start multiple small hospitals in various parts of the country again came up. Then I thought this will be again a failing journey if I am in one geography and I'm operating in another geography. So why not consolidate it? So way back in Harvard, they told me, Doc, you will fail. Just capture the market in one district, one state, or maybe even half of that state, and you will sustain forever. And how are we going to do it? Digital access and approach is the only medium I can do. That's how this economics of scale came into my business. So we've started with the hospital in Rajkot. Then how do I help my first goal of saving somebody's life? In a conference, I met a couple of innovators, a couple of medtech guys. I said they're equally doing fantastic in their IoT, AI, cardiovascular, preventive, amazing. What about a collaboration with them? Those guys are bleeding. They have the money. Investors are banging them. But we need scalability of them. And here I am as a hospital provider. So I formed, a consortium. Let's have a disruptive collaboration where all stakeholders win. I am a cardiologist. I can't be AI specialist or a medtech device or a coding guy. No, I have my partner who's a technologist. I have a computer science whiz guy who can put this on a app, laptop, whatever. So collaborated with a couple of medtech again on a conference like this in Mumbai. So formed a pilot project. I said, let's do something on a village. So we started with about 5 villages in Bihar and in Gujarat, and you see those results. My village, my collaboration was just on a simple employment of a villager who's only equipped to use a smartphone, because smartphones are now even in a small rickshawala or a tangawala in a village uses it. So why can't I empower them with something which is going to save somebody's life and he's going to be a hero in his own village? So gave him all the medtech devices. I said, please use it for free. I give you certain salaries. And that turned out wonders. I mean, you'll be surprised. You know, I have started these clinics with zero cost. No money from the patient. I'm not going to charge. Rather, I pay the patient some vitamin tablets to come in, at least give me your ECG, give me your blood pressure, give me what problems you've been facing so that we can provide you with solutions. So I'm kind of incentivizing my patients in a village. That fascinated everybody. And the government was like, oh, dog, you can't do it free. I said, I'm doing it for free. Like Dr. Ravi Gaur said, yes, it's more of one patient losses, 1,000 patient gains. So that has given me the rewards. And one digital clinic in a village with the first installation of mine was in Bihar, a small district called Supol. You won't believe, 9:30 in the night, I get a message in my Android tab. Doc, there's a patient with an atrial fibrillation. A heart is pumping more than 200 beats a minute. And I'm like, wow, what do I do? Is there a medical hospital? Is there a doctor? Is there a medical shop? Nothing. All right. So made him go to a small pharma shop, all via a tele-video call app, that is a telemedicine app in 2000, just before COVID. 2000, I think of Feb 2019, just before that. Amazing result. That just a small few doses of tablets could give him 6 hours of life. He moved to a medical college in Darbhanga and he got infiltrated in an ICU. A heart was reverted and the doctors were amazed. Who prescribed you this medicine? And I'm sitting in Gujarat and he's sitting in Bihar, close to the Nepal border. See the technology which is just saved and see the impact. You won't believe that clinic guy had got packets of sweets, delivered in his house for a thank you note. See, that feeling as a doctor is amazing. Well, I could save somebody in the right and give certain advices. If he could feel that this medication or advice by a doctor could really give him some solace in his life for himself and his family, yes, I win my journey. And no investment to me at all. I just collaborated. Then came in the height of scale. How do I bring in more patients into my hospital? How I, bring in a differentiator? Corporates, yes, they do charge extensively high because they have, other obligations to meet. But why not? I mean, I'm a, self-made, entrepreneur. I've not got any investors now. So we've started more clinics. I'm seeing more number of results. So there's huge employment. There's huge, opportunity of, impact and taking this forward quickly. Well, I've just told you about the problem statement about an urban and a rural population. In a rural population, less of doctors, no cardiac hospital, no proper infrastructure in cardiology, no proper consultation. This is how my rural clinics does act. Early symptoms, ECG is taken, the collaborative AI solutions filters the normal with abnormal ones. The abnormal ones comes to me or at my command center. Somebody is there to advise them, yes, this is the medication. And you need to reach this hospital, you need to reach this ambulance. And again, with collaboration, the ambulance is brought in at his doorstep and brings him to a nearest heart hospital. And that's the impact cycle which you're looking at. And with this thought, we have started this project called Swaraj Ki Dhadkan, Rural Digital Health Saving Lives. And this is, one of the odd small command center we've started with. Now we have a larger one. These are the offerings where you can see my rural clinic is just in a jhopda. In a rainy season, this doesn't exist, it disappears. So what we've made is we've made a mobile clinic. Somebody in the village carries the entire devices in his box. Like he comes with a small, bell. Anybody has a problem, come to me. And all connected to the cloud, AI, IoT, getting collaborated into my heart hospital, into my command center. This is a small review and see the journey so far. 50,000 rural patients, consulted. This is about 2 years old data now, even more. More than 100 villages covered. More than 40 rural e-clinics set up already now. 10 more in the pipeline in Gujarat. And by doing so, we have volumes. So read down on the affordability. Making the hospital more affordable. And these impact has given me more repeats into my hospital. So I'm sustaining my hospital, venture with this. And this is the app which we just, launched during the COVID for the need of the hour. And this we are merging it with, with our clinic as well. Few use case studies of how, this has really created an impact in these small villages of Kalawar in Jamkunda, which is rural Rajkot. And as I said, this has given more traction to my heart hospitals. I'm optimizing my operation theater. I mean, everybody uses, I'm sure everybody is, most of them in the healthcare. And OTs just run for 4 to 5 hours a day. But my OT runs 10 hours a day. I pay the same, staff the same money, depreciate the same. But I need to optimize my asset utilization, increase my, flow into my, cath lab and to my operation theater. And end of the day, yes, this is going to impact. And there's, if I'm talking to any, groups, yes, there's impact investing with profitability, improving primary healthcare with a digital approach, with Grameen Seva, which is coming in more, attract to primary, improve the primary healthcare, and with the project of Swaraj Ki Dhadkan. I want to focus over there for the next couple of years, want to just ensure that, my company, that is Plexus, is in the air, in the cloud, in the house, in rural, in village, in each, everybody's brand established. Yes, this is, and create a niche, ecosystem of, healthcare delivery using digital. There's everything like rural, AI, remote, tele, golden hour treatment. So now we have started, apart from, the cath lab, we are focusing even now into, acute stroke. Stroke, because the pathology of heart attack is, for stroke as well is the same. So why not, have stroke into this? So prevent paralysis, at least delay the paralysis, at least early diagnose the paralysis by certain. So I'm in touch with certain, startups for stroke prevention. So in my ICU, in my rural clinics, I've just collaborated, given them the space and the tech space to do their pilot on neurospace, which is like phenomenal. So, see my clinic over here. Hardly have people of this 400. The city sleeps at 5 in the evening. There's nobody in the village. These are openings of my clinic which I've been doing, and I'm personally visiting. Well, the vision of the company is to set up more than 250 rural clinics in Gujarat, and further cut down, add more, heart hospitals in each smallest district, where we can at least send the patient during the golden hours to the heart interventional lab, where we can really, get him operated or intervened. Well, I mean, this company, Plexus, offers the end-to-end, is the only company rather I could see at this moment, end-to-end acute cardiac care, emergency heart care via rural clinics, home services, telecardiology, and a full-fledged dedicated heart hospital connected using tech. Well, I mean, in one of the forums where I was speaking, and from my business school, where I've learned that technology is going to, really, scale up, or going to add on to your value add. So, this trends in digital healthcare, I mean, I'm sure everybody knows about this: AI, IoT, tele, big data, immersive, mobile, 3D printing, blockchain, cloud computing, genomics. How about me putting all those into my ecosystem, have a 12-month runway, and implement all of those? Which is practically, I'm just covering few of them. I've already started covering few of them. There's AI, there's an IoT, there's a telemedicine, and now the next is I'm going to launch on immersive, that is AR and VR, bringing in more value to what I'm providing into my patients in the same geography, so that there is something new which the patients really feel good about it. Like Bhuvan just said, something what you are offering differently to somebody. This is the experience. That's what these tech will provide amazing experience. Likewise, blockchain. I was in the India blockchain conclave, where the hardest lesson we all learned is how safe a data is. So that's where I'm looking at. This is I'm like yesterday someone spoke about metaverse, spoke about Web3. This is my next innovation. By a couple of months, I will be getting this launched very shortly. Already my pilot on cardiology is in the space. You could see that. Metaverse in cardiology, a kind of this picture itself speaks a lot. As a doctor, I get navigated. I experiment. That's where I can cut down on negligence, on expertise. There's quite a lot we can talk about. Well, I mean, a small take-home message where I feel this was important. We need to, move on to create a value-based healthcare delivery. Because end of the day is a value which we are, giving up. And as a doctor, I need to bring a lot of value. And how we collaborate, I'm not being an industry expert. How do we collaborate using, on the medtech, fintech, etc., to build in an ecosystem and create that value? And digital health to enhance efficiency of the hospital assets. So this is something which has to be kept in mind, and a digital approach to as a tool to enhance the care pathway with patient centricity is what I'm looking at, and I want this to be taken as a message with everybody. Let's focus on this. The journey is much easier. These are the few recognitions from the. This is something which I am shortly going to launch is a heart hospital in a metaverse in the same geography, in the same space, in same Rajkot. Well, this is my next innovation, which I'll be shortly getting into this, and that again is going to be collaborative with a company called Healers, which is on virtual space. Thanks.
Thank you, Amit. Wonderful hearing you journey, because I met you a couple of, I think 5 years back. We talked about what you were doing. At that time, he had a very interesting thought. I think it's not very translated well in your vision. That was something if you're driving your car and if you have some cardiac cardiac system, the car or the app will guide you nearest hospital. And that's something probably that you integrated now the hospital also. So that's getting in. Yeah, that's wonderful. I think we are unfortunately short of time. We have run out of time. I wish we would have continued with the questions and answers probably, but we can have an offline question. I have to sum up this session now. Few things which I said. First and foremost, I'll take 1 minute with that. Preventive health care. Why we require digital health more attention? If you look at the average lifespan of this, it has gone from 58 years. Harsh was talking about 36, about 36 years back. Now it is like 58 to 70 years. But if you look at the average quality of life in that's a good quality of life. That still remains 58 and then come down to 70. That means many chronic diseases are happening. Something is wrong. We need to really take our health in our own hands and prevent getting the disease. That's the first thing. And if we have a disease, lifespan is increased, chronic diseases are increased. How do you monitor and make your life better and of course disease and well? And that's something what we require. Just one line for all the programs. They are just noted down for Ultrahuman. I think that's a good name. And just probably a slogan we can talk. Be somebody nobody thought you would be. I think if you can adopt that, you will be having that kind of thing. You can achieve whatever you want. Zyla, I think Khushboo, I think that's something you heard about what you're doing is every human being is an authority of their own health. I think that personalization is something important. If you look after all the factors, integrate them together, that's going to work very well. And that's a personalized solution or personalized healthcare solution you're talking about. When it comes to FootSecure, I think all of us probably have right from childhood till we keep getting hurt. There is some kind of wound always happens. So wound care, I think what we all need because it's an integrated approach. And healing is a process. And if we analyze our wound well, I think healing becomes faster and much better. And that's something what we talk about. A lot of things to be done into that. We really require to integrate, and we need more wound care specialists that wounds and 1.3 million diabetic amputation happening. That's something alarming, and we should be able about. Lastly, I'll talk about the Plexus, heart care. I think heart care is something definitely every heart needs a care. And if it's I think it's the life other way. They say that for better quality of better health for heart. It's good for heart to disconnect. But I think it's other way. It's very important to connect digitally if you want a better heart care. And that's something that's doing. Great to all of you. And thank you so much for the wonderful session. We can have questions offline lunch break. Thank you.
Thank you all for inviting us. Not a question, but just a statement. I think I missed in the slide. If anybody is interested in AI in wound care, and if they would want to work with us, please feel free to connect offline.
I'm telling you, this is on recorded data. Is lot of metabolic problems, cardio diabetes is on the rise. Youngsters are getting affected. I mean, I'm running a hospital. I'm seeing a lot of youngsters getting inside the critical care with fresh heart attacks. So there is a pandemic or epidemic, whichever word you like to. Please be careful and try to invest in your own health first and your family, because there is an epidemic or a pandemic which can come out if we just be little casual about our own health. So this is the message which I would like to give. Is a new form of metabolic problems on NCD which is on the rise now.
Thank you, sir.
Thank you for your enlightenment on how startups are revolutionizing the health delivery system. I would request now Dr. Ravi Gaur to felicitate all the presentators here. Please welcome this with a loud round of applause.
Dr. Sanjay Sharma, co-founder of FootSecure Lab. Dr. Amit Raj, Managing Director of Plexus Cardiac Care.
Thank you, sir.
Ms. Khushboo Agarwal, founder Zyla Health. Mr. Bhuvan Srinivasan, Chief Business Officer, Ultrahuman. I would request Dr. V.K. Singh to come upon the stage to felicitate Dr. Ravi Gaur.
Please welcome this
After
with a loud
lunch,
round
with
of
all the
applause.
energy.
You may not know, Ravi and myself have come together. Today.
Dr. Ravi Gaur, founder, director, and chairman of Medical Advisory Committee, Unipath, DRG Specialty Laboratories.